I'm Eric Moore. I'm a head and neck surgeon here at the Mayo Clinic, and I'm here with a patient of mine, Heidi, who had a parotid gland tumor and parotid gland surgery, and we're discussing aspects of parotid gland tumors and surgery. Heidi, thank you for being with us.
Thank you, Dr. Moore. So I clearly traveled to the Mayo Clinic to have surgery, and that's something that many people consider. And it's very unusual to be able to come to a medical facility and to have a consultation with you, to have all the preoperative appointments done, and have surgery within a couple of days. So is it fair to say that people who are traveling from out of town, they can accomplish all of those things with one trip?
Yes, I think our system is designed with the knowledge of the fact that most patients who we see and treat do not live here in Rochester, Minnesota, and often don't live in the state of Minnesota, and so are traveling. And we're very cognizant of the fact that that's time intensive, time away from their jobs and families, expensive. And so our system is designed to see patients brand new and do a very thorough job of doing diagnosis and treatment planning, but also execute that treatment in that episode of care while they're here. And we try very hard to see a patient and do all of that work and then get them into treatment, often in the operating room, within a day or two of that visit. For eons, we have operated under the schedule that we see patients in clinic one day and operate the next, and we try to arrange our surgical schedule so that we don't fall behind and can accommodate those patients that we're seeing that week. Obviously, life happens and things arise, and that can't always be done. And if that's extremely important to the patient, I also would encourage them at the time that they interact and make their appointment that they let the schedulers and the people they're talking to know that, so that we're aware of that as well. And those people will often be able to advise them, well, this week the surgical schedule is just horrendously busy and they might not be able to do it the next day or even that week. But in general, we realize that people are making the effort to come here, and we adjust accordingly and try to get that episode of care accomplished in a short period of time.
Okay. And so one of the questions that I had for you as well is, okay, if I travel here to have surgery, how long do I need to stay in the area after surgery is completed before I can go home?
For most parotid gland surgery, the surgery is for us an overnight stay in the hospital and usually out the next day. There are certain things that might extend that, the extent of the surgery, the type of tumor, things like that, how the patient is doing after the operation. For most of the time, the patient can be discharged from the hospital the day after surgery. And our intention is that most of the time they can travel very soon after there. We set up our operations so that they don't have to be seen back for suture removal in 3 or 4 days, don't have to come back for drain removal in several days. Everything's done at the operation and within the day after the operation. And we want to have some contact with that patient several weeks after that operation to make sure that everything's going well, or sooner if they're having problems, by them contacting us and let us know that. But most people can leave the hospital day after the surgery and potentially travel that day. The questions I commonly get are, can I fly the day after? I tell people often, don't plan on flying home the day after surgery because that doesn't give us any leeway. But potentially the day after that, they could fly home. And if they had to fly home the day after surgery, it wouldn't be dangerous. In most circumstances, they could do it. As far as the when they come back, we also realize that people, it's difficult for them to travel back, and so we're working on trying to arrange video follow-up. There fortunately isn't very much that I have to do by laying hands on people after parotid gland surgery. Most of it goes well. So I find it very helpful to talk to people and see what they're experiencing and answer questions that may have arisen, things they're worried about. But we can usually do that. I like to do it in a video visit rather than over the phone, but we're designing our system so they don't have to come back in that 2 weeks right afterwards to have a face-to-face visit if everything's going fine, that we can do that in some type of video correspondence. Yes.
So I was just going to dovetail on the flying thing. So I think the thing that concerns a lot of people is that if the cabin pressure changes might cause pain to the ear, cause some sort of problems, or increase the swelling. So if anybody has those concerns, what would you say to them?
So problems with pressure differential, like you experience on taking off and landing in an airplane, come about from air solid interfaces. So the ears bother people because behind our eardrum is an air-filled cavity that is isolated from the outside world by a relatively closed tube that goes into the back of the nose called the eustachian tube. And so if that eustachian tube isn't able to open and close appropriately, that pressure behind the eardrum becomes different from the atmospheric pressure in the nose, and that causes a pressure differential, and that causes pain or squeeze or plugged feeling at least. Most of the time, parotid gland surgery doesn't affect the eustachian tube. So we're not in the back of the nose, we're not really around the eustachian tube, we're not causing a lot of inflammation there. People should be able to clear their ears. If they have a lot of trouble clearing their ears and really have to bear down and squeeze and valsalva, that might be uncomfortable to do after parotid gland surgery, but not really dangerous to do after parotid gland surgery. Did you fly home after your operation?
I did not. I drove home.
Okay.
I didn't drive. My family members drove me home.
And how did you feel during that time?
I felt fine. I would definitely recommend that people bring something to, cushion their head, whether it's a pillow or a blanket or something. But I think you had told me to get out of the car every couple of hours and just walk around, which I did do. And it really wasn't a problem at all going home from here.
That's an important point, and that's routine advice that we give anybody after any type of surgery who's going to travel soon after there. Usually you sit down in a car or sit down in an airplane seat and you have your knees bent and your legs at 90 degrees, and that's a setup right after surgery for deep venous thrombosis. And so the act of just getting up and stretching your legs and walking around even a few steps every couple of hours is good routine advice to prevent yourself from getting into that type of problem. And you can do that, certainly if you're traveling by car, you can do that in an airplane with a little bit of effort. You don't have to take a long walk, but just get up and move every couple of hours to try to prevent that.
Okay. So one of the other issues that I had spoken to you about was if I have surgery here and I'm traveling to have that surgery, what happens when I go home if for some reason I have some sort of complication and I can't come to see you right away because I'm several hours away? Mm-hmm. So what is your advice to people that might be concerned about that? What's going to happen after surgery when I go home?
Contact us. So the best way to deal with any type of problem that's bothering someone after a surgery is to talk to the person who was connected to that surgery, their surgeon or somebody very familiar with that surgery. In parotid surgery, most of the things that happen right after the surgery that are of concern do not need urgent, immediate treatment. They need reassurance. They need descriptions of what's happening. There are some problems that can occur. People can get hematoma, blood underneath the skin, even several days later after parotid surgery. They can get salivary fluid, what we call a sialocele, but the saliva gland cut edge can leak saliva underneath the skin and cause fluid and swelling, and that happens sometimes several days later with eating. They could rarely, but still could develop an infection of the surgical bed or skin, or they could have some type of perioperative complication like a deep venous thrombosis or something wrong with their blood pressure or heart that needs some attention. The vast majority of these things are not emergencies. They will, patients will get a lot of reassurance by talking to their surgeon. And so we always encourage that. One of the problems, unfortunately in this country, medical care is usually readily available, and people will seek that medical care through their primary physician or through an emergency room or through a friend or through another head and neck surgeon. But it's very difficult for people to interpret what's happening who don't do parotid gland surgery to that patient right after parotid gland surgery. And so that's why I encourage people to talk to their surgeon first, because they're going to usually have seen that before, know if it's common or uncommon or a problem or not a problem. Having a picture is really helpful for us, because sometimes when people are describing something that's happening to them, I've got a picture in my mind that may be very different than the picture in their mind, what they're describing, and we're at a disconnect, so we don't know what to do next. And sometimes being able to just send me a photograph, which is easy to do these days for most people, is very helpful, and then we can make an interpretation. Let's take the step that there is a problem and something does need to be done. Sometimes people can seek care locally and get plugged into someone with experience and get that problem taken care of very well. Sometimes that person is not readily available in their area and they have to come back. But the reason we're comfortable doing parotid gland surgery and letting people go home is because almost every time they don't need to come back emergently for a problem. Things are going to be okay with some explanation, some minimal treatment.
Okay, so it sounds like your advice would be that people should have a plan, discuss this with their surgeon prior to surgery so that if something should occur, they know what to do.
Absolutely.
Okay.
Absolutely. That should be a really transparent part of the preoperative discussion and certainly the postoperative discussion before they go home of what to do with these potential problems.
Thank you.